Then, if you permit, I would like to say a few words to start the discussion. I would like to draw your attention to 2 points, which I consider very important. I'm a pediatrician who has been dealing with hematological diseases in pediatrics. So currently we are facing a couple of problems related to intrauterine tumor diagnostics and also managing children of the first year of age that usually are excluded from statistical analysis usually. And these children are very important for us because they are not included in general development of new diagnostic and treatment methods. And the second issue that fell beyond the scope of our discussion is adolescence and treatment of adolescence. In our country, slowly but steadily, we changing legislation and constitution, we changed our practices. According to the Soviet constitution, children were considered aged 15 years and below. Then children are now classified as those aged 18 and below. And we are based on the guidelines of WHO. However, we do not treat young adults aged 21 and above. These are still treated in adults clinics. And as I know, this problem is also in Asian countries. It means that young adults are undertreated. They are usually treated with milder protocols that limit the efficacy of treatment. And because of acquired diseases that may be already diagnosed in adults, and because of comorbidity that may be present usually in adults, they get undertreated. And in the Russian Federation, we decided to go the following way. Over the recent 15 years, we have been using children's protocols in oncological hematology to treat malignant leukemias and non-Hodgkin lymphomas in adults aged 30 and below, because these patients can be cured the same way as adolescents. And we understand that pediatricians usually suggest more aggressive treatment, and they achieve usually better results in children than in adults and in young adults. And in the European countries, in particular in Germany, and now even in Russia, we organize the joint meetings between pediatric and adult oncologists in order to synchronize the protocols, to harmonize the protocols between children and adult practice. Because when children are handed over to the adult oncologist, usually the treatment programs are changed completely. And the third point I would like to discuss with you is development of radiological methods and nuclear medicine in pediatrics. This is a very big problem in general. Japan is the leading country in this area. And Japan, the country having 10 proton centers and also target nuclear medicine centers that no other country has available. Japan was one of the pioneer company to develop the nuclear medicine. These methods are aimed at potentially incurable currently incurable diseases in oncology. And we hope that in 2017, in Kyoto, we will be demonstrated what can be done in nuclear medicine in pediatrics. All the innovations that take place in oncology, also taking into account up to 10 or even 15 new novel target drugs in medicine, also are related to development of new methods of treatment. However, the trials of these new drugs are not done in our clinics. We are based on international practice of using these drugs. And what Professor Nakagawara mentioned in his speech is collaboration. And this special collaboration should be aimed at cooperative studies to exclude selection of patients and doctors in order to achieve optimal results.
Rumyantsev comments. But I would like to invite Carlos to give us some words on your experience on how you have been helping the developing countries in the past decades and how this may be applied to more Asian countries and Asian centers.
Sure, happy to make some comments. I would like to start by reminding everyone what we discussed the other day, that actually by the end of this decade, 2/3 of all children with cancer will be in Asia. Yeah. And so that calls for special attention and very targeted programs. As we know, as countries with limited resources, many of them are in Asia, are advancing in their healthcare systems, and under 5 mortality rates drop, the incidence of cancer increases just because there are less competing risks. So I feel like there will be, I would not call it an explosion, but definitely the healthcare systems in Asia will be challenged by the beginning of this process where we'll start seeing many more kids with cancer. And so I think that will require go beyond, just talking or education. I think it needs a very integrated effort by, local leaders as well as international leading institutions, say in the United States, in Europe, in Russia as well, that could coordinate these efforts. So we at St. Jude are trying to think of what are the best ways to start addressing this problem, and we are thinking of coordinating with other agencies and other institutions. But bottom line, I think we have 3 main pieces to this puzzle. One is capacity building, so we need to make sure that institutions, regions, hospitals are ready to take care of the kids with cancer. That means building institutions that can do multidisciplinary care, excellent diagnosis, good follow-up, survivorship, decreased abandonment, etc. Then a second piece is education. So we need to really focus on educating the next generation of leaders locally. That means oncologists, nurses, pathologists, surgeons. And that calls, I guess, or again, for a unified effort at creating good curricula, good training centers that could provide regional capacity. Sometimes countries may not be able to provide that, so I think it's important that regions within the country can actually accept individuals for training, and that the regulations are such that these individuals can go back to their countries to train. But bottom line, I think that having regional centers of excellence for training of doctors and nurses primarily would be critical. And the third piece, which I think is also very important, is research. It has been mentioned during this session and before how important it is to bring research into the building of capacity. I think that if we have learned something in North America and Europe, is that we have advanced in the care of children with cancer through research. And so integrating clinical research, translational research, developing regional networks, cooperative groups is critical. So I think these three pieces, building capacity, educating the next generation, and building research capacity will be critical. So many institutions around the world are trying to help with that, and at St. Jude we're trying to help with that in Asia as well, trying to develop these regional networks. So I think that we can do it, but we need to do it all together. So we have more kids like the ones that are coming now, coming to our clinics, to our hospitals, and entering the adult forces.
Right. Thank you, Carlos, for your words of wisdom. I think you summarized some very important key points that based on your vast experience and the long history of helping developing countries. I think this is very important, and also just echoing the other speakers that they have mentioned in their talks earlier on. So is there any other comments or any views from other participants?
А вот, извините, я хотела бы выступить.
I would like to take a floor, if you permit. There is a gap in our work. I'm a consultant, I'm a pediatric oncologist working in Moscow. I'm also responsible for northern eastern district of Moscow, and I would like to draw your attention to the following problem. It could be easily solved, perhaps with your help. There are so many children admitted in hospitals with nevus, with nevi, and the problem is a little even funny, because these children are referred to our clinic by dermatologists for final conclusion, and they use dermatoscope.
Oncologists do not have dermatoscopes. Nobody supplies them with that. There's no allocation of funds for dermatoscopes, although many dermatologists, skin specialists have it. And they teach these algorithms, dermatoscopic parameters. This is something that dermatologists, skin specialists are taught. Whereas an oncologist has to sort of learn at his own expense, or her own expense. This problem is rising, is on the rise, because our public are now well aware, because of the internet, is being aware of its medical knowledge, is sort of getting more and more knowledgeable, and very often they're very unhappy, and they say, why is it that you don't have dermatoscope? You are an oncologist, how are you going to make a conclusion by just examining the patient? We're not happy with that. Maybe somebody will help us. And because we know that district oncologists have worked in every district. Recently we held a meeting in Rachunsky and Tsiganov's office. But this problem applies to every oncologist in Moscow. May I give the answer to this question? Yes. I suppose this is a problem we can be addressed. It's much more profound than dermatoscope alone, to be honest. In Russia we have a problem. Regrettably, we now have, it has to do with this. We don't have a good class, a good level, what we call dermatomorphologists. They are pathologists who work in dermatology alone, morphologists who work in dermatology alone. You know that in many developed countries, high-income countries, any dermatologist, consults the patient after he has received a biopsy finding. We would like, well, the specialists in oncology should be guided by the standards, not visual examination of patients. Instead, should give a reliable diagnosis being confirmed by pathology findings. We'll certainly discuss it with chief oncologists of the city of Moscow and with the city management, with the city mayor, and I'm sure we will make a special allocation. We shall hold a meeting, dedicated meeting, because indeed it is a burning problem, especially in children. Our children are, Russia is a northern country in many ways. Nowadays, they travel broadly to many countries, and getting insulation, intensely insulation, and they then develop skin manifestations which are hard to diagnose. That is why I promised you that we shall address this matter, and you will soon hear about it in the very near future. Thank you very much for your comment.